Okay, everyone, we are back talking about why we do combos of procedures, and because we're all about maximal results, and we're thinking about Mother's Day, and we always try to put together something to make it more doable for people. But we also are very much about doing it perfectly, if that word exists in medicine, but as perfectly as you can, as thoroughly as you can. And you've heard us say before that if you go in and you do something for 30 minutes or oftentimes even 1 hour, you get a milli fraction of the result. So we're going to talk about some combos of what we do in the office. We're putting together for people who can come in, procedures, but we're also informing you because as you, wherever you are, can do things and ask your practitioner so you know what's the best and why.
And synergy. Synergy is huge. When you target the same area, so like let's say for instance, I want to kind of lift my face a little bit, I could lift it with many different modalities, but if I choose to use 1, 2, or 3 different modalities at the same time, I'm getting 3 times the stem cell response because I'm targeting those stem cells in 3 different ways. So that's the beauty of synergy as well. And we've seen it firsthand.
Absolutely, which is why increasingly we do usually 2 things together and rarely 1. So let's talk about some of the things we do. Okay, so, and for Mother's Day, quick fix. Everybody wants a quick fix, but understand that in medicine, look, the body just doesn't work like that overall, and internally you've got to be good. Otherwise, anything we do externally doesn't work as well, which is why we're obsessed about that as well.
Exactly.
And so,
and then maybe with as little downtime as possible.
As little downtime as possible. So let's talk about some of those things. And yes, men always get, you started to say about men, they always get better results because they have thicker collagen, they have more collagen, so everything we do works better on them than women who have thinner collagen. That's why it takes longer for your neck to tighten, harder, so an ounce of prevention's worth a lifetime of cure. Around your eyes, thinner skin, less collagen. Men have thicker skin, they always get a better result. We just have to deal with that. But, so 2 of the things that we put together quite a bit is clear lift, okay, and then we inject carbon dioxide gas underneath the skin, which goes down deeply, turns on the stem cells, so everything you do gives you a better result. So we'll do those 2 together. CO2 also forces new collagen production because it's turning on those stem cells, because at the end of the day it's all about the stem cells. And so when we do the CO2, and at some point we'll do a video where they can do it to me because I need everything, but
we all need everything.
We all need everything. But with CO2 and clear lift, okay, that's a really good combo. And talk about clear lift for a second.
Clear lift is amazing. Clear lift is what's called an ND YAG laser or a 1064 wavelength. So it is a true laser. It's a laser beam that's designed to actually work for any skin color, number 1. You may have heard about this laser that is used for hair removal or brown spot removal or whatever. ND YAG is probably one of the first lasers that has ever been developed. Anyway,
skin of any color.
Skin of any color can use this because it's a wavelength that's driven down into the skin, but it's at a longer pulse width or time frame, so it's safer for darker skin.
And around your eyes.
Absolutely. Clear lift is fractionized. So what that means is they've taken this 1064 wavelength that would basically bombard a brown spot or a tattoo or hair or whatnot, and they've fractionalized it into these tiny little droplets. So it's like it's raining.
So instead of one big beam, it's broken up into a bunch of little beams, and you're going over the entire skin, the eyelids, the neck, the chest, the hands.
Absolutely. Anywhere and everywhere you want to have it done, and again, on any skin color.
And what results do you get?
You get a tightening and a lifting. Now, sometimes you're going to see a bit of a tightening and a lifting right off the bat because we have a little bit of a tightening that occurs right off with superficial collagen tightening. But the majority of the results usually 30 to 60 to 90 days before you see the optimal result from the treatment.
Full result.
Exactly.
Yeah.
This is also a treatment where we've seen a little bit of a change in the overall texture of the skin, a more refined, smooth look to the skin, less pore visibility, as well as redness and some browns.
Okay, and so what that means is it's another one of those pieces of equipment that you should do intermittently.
Absolutely.
Because as you do it, look, you got to maintain. We're not frozen in time. We do something, but we continue to age. We continue to degrade. Our stem cells want to retire, and we don't want them to. We want them to run the marathon on a regular basis.
Exactly.
So clearly, if you should have done twice a year, three times a year.
It depends. There are some people that I have as patients, and then in some countries, they refer to this as what's called laser toning. It's huge in China. And in China, they use this as kind of a facial, so to speak, to where they maintain a nice improvement with the overall texture and tone of the skin. And they'll have patients come in every month, so to speak, to have it done.
But if people have melasma...
But exactly, you want to be careful with some individuals.
You don't want melasma.
Exactly. This may not be the right treatment for everybody. That's why it's important that it's discussed.
And also if you're using skin products,
exactly.
Number one, it's just like doing your internals, you're using skin products. You're already working with a more youthfully functioning skin, then you do things like this on top of it, which is why we are all about treating all the pieces of the puzzle and then using the pieces of equipment that are the strongest, best tools for the job, and you've got to do them correctly enough so that you get the best result,
yes.
a result.
So,
the best result.
Exactly. And as we do it, we really give an aggressive, a very thorough, comprehensive treatment. We don't miss a spot. We're on the earlobes.
And you go behind the ears.
In these areas.
And you can do whatever you want to do. Can you do the body? Because we care about the body.
We usually, I don't know.
Because the body's skin's so thick.
I think there are other modalities that probably work a little bit better, and we can definitely
we'll
talk about those. But from maybe the décolleté or the sternal area upward, and even the hands.
Earlobes, to help tighten the earlobes,
exactly.
etc. Because our earlobes get floppy as we go down the path of life.
Absolutely. I would say the average person that just kind of wants to maintain and do some things to avoid the aging process maybe would come in maybe 2, 3, 4 times a year. It just depends on where they're at in their life.
2 times a year at least.
Yeah,
okay.
I would say.
Then we blow CO2 underneath there because it goes more deeply. Again, synergistically is making new collagen production better because you're treating the skin, and you always want to be treating the skin from the surface all the way down to the muscle. And if we can hit the fascia that surrounds the muscle,
yes.
We want to tighten that up as well because that's part of why your eyelids get floppy. It not just the skin, it's the muscle as well.
Exactly, and it works really nicely for the eyelids also. It gives a nice perk to them. There are definitely other things we can use.
Okay, so let's talk about eyelids you brought up. Okay, which everybody needs to be getting their eyelids treated. So of course there's clear lip.
Right.
Of course there's Forma. And another thing that we put together for Mother's Day, which is also something that people should be doing ideally twice a year, at least once a year, is Forma, which is a tightening technology. It's not a true laser, but it's radio frequency, lifts and tightens. We do your face, your eyelids, your neck. To do it right, depending on the size of your face, it's anywhere from 2 to 3 hours, depending on the size of your face. Because if you don't, you're not going to get a result that's coming in once a week or once a month or whatever. In my opinion, medicine's the art as well as the science, is not the way to do it. But Forma with CO2.
Absolutely, that's another great one.
And it's great for your eyelids as well.
You're hitting those stem cells with the radio frequency or the Forma from the outside in, and then you're turning
driving that heat down.
Exactly. And then the CO2 is turning the stem cells on inside.
Inside out.
Exactly. So you're really maximizing the improvement that can be obtained during that treatment.
Optimal youthful functioning, as I love to say. And then the other thing for eyelids, there's IndyMed.
IndyMed is another great one. IndyMed is also a radio
And
frequency
CO2.
system. Exactly. So they work well together as also. And then IndyMed can be combined with itself in that it's just a non-invasive radio frequency. And then we can do what's called intensive, which is a microneedling that goes with that. There's a bit of downtime associated with that, so it's probably not something you would want to do the day of a big event. Whereas you could almost...
Yeah, that has downtime.
Exactly, there's a bit of downtime with that
But
one.
Forma, CO2, clear lift, no downtime. I mean, you can be red for an hour or so,
Right.
Especially on the forehead with Forma, because we're driving that heat down to try to get down to the muscle and even tighten that, the fascia that surrounds
Exactly.
it. And then let's turn for a second to the body, okay?
Oh, yes.
Because this is another obsession that we have.
And rightfully so. I mean, we don't want our face, our neck
Or
to
piece
look
of
great.
equipment.
And then,
One of
the
these
rest of
pieces of
us to be
equipment.
kind of not matching what you see
Yeah,
on the
because
top.
when you take off your clothes, you want to look the same age. Or
Exactly.
look, people come in all the time complaining about their arms. This is hormones. You lose your fat as you go down the path of life because your hormones go down. And so part of what we're doing on a regular basis is, look, there's Evolve that's in mode, which is a radio frequency device. There's also, we do a stronger Forma on the body.
Right,
Okay.
exactly.
And but a lot of times, depending on the fat, because fat moves down as we go down the path of life, it doesn't make any difference how thin you are. Fat goes down. It's God's joke on us, but what we do oftentimes is body FX.
Yes.
Which we do, I mean, mommy makeover sort of things where you're tightening up the abdomen.
Right.
Evolve does that as well. And oftentimes what we're combining is we've got Evolve,
Right.
which tightens the muscles, which tightens, and it competes with
M-Sculpt.
M-Sculpt. Okay, it's a stronger version of M-Sculpt. Then you've got the Body FX. It has one of those that tightens the skin and helps burn the fat, and it destroys the fat forever. But remember, it only burns so much fat at one
Right,
time.
exactly.
And then there's one that tightens the skin. So sometimes Valerie and I may be working together, and one of us is doing Body FX. We've got the Evolve on people. We're blowing CO2 underneath the skin because it helps get rid of cellulite. Also, O2.
Oh, yes,
Underneath the eyelids for fat.
Yes.
In
The
fat
submental.
pockets.
Yes,
Yeah,
exactly.
and if on your knees or you've got saddlebags, sometimes on your knees, that's because your growth hormone is low. All of those. So we oftentimes will work together doing that. But so we put together some packages of sorts to make it easier, but we wanted to inform you first of all the different things. And what
Right.
have I forgotten about? I'm sure I've
Oh
forgotten
my goodness,
things.
let's see. I think we've pretty much hit on them.
And then also retin-A
Yeah,
on your
that's-
arms. Look, the other thing is on your body, you just don't want to use things. You've got to exfoliate your skin.
Right.
On your body as well.
And the whole body renewal.
Whole body renew.
One of my
exfoliating
very
cloths,
favorite products of
Yeah.
all. I love that
which is
stuff.
spectacular for melasma as well. So that
Evening out, brightening up, you just look good.
and my peel. I have a lot of people who are using my peel. They do one dropper full on this arm, one dropper full on this arm. You put it on, you rub it in, because we're also help bringing up the sun damage.
Absolutely.
And then we may Lumecca it to get rid of the sun damage. But you can do peel, you do whole body renew, and then you can do my vitamin A plus.
Right.
And then it's a prescription, but we have people using tretinoin on their arms, on their thighs. It's a fat-soluble vitamin. You have to be careful. We have to tell you how to use it, which is why it's prescription. So we have a lot of combinations.
Right. A lot of different things to address discoloration, fat, sagging skin,
eyelids,
you name it.
little lines around your mouth.
And one other thing we should say too, all of this is done without any surgical scars or a strange appearance to you afterward.
So you don't ever look like, you can be doing a lot, but you're not caught looking like you're done.
It's you.
And that includes well-conducted Botox and filler. Yes, Dr. Non-Toxic does recommend Botox because, look, some people have a very a face that the muscles are really strong.
Right.
And people start looking at that. They don't look at the eyes, the window to the soul. And so a little Botox is a good thing. And as we go down the path of life, especially thin skin like this, you have to put a little hyaluronic filler in there.
Right, exactly.
You heard me say hyaluronic, not some of the other fillers that we've done a video on, because you've got to do volume. Otherwise, because the muscles are thinning, the teeth are thinning, the bones are thinning, you got to put some filler in that skin so that you don't look like a skeleton with skin pulled over it, no matter how much we thicken your skin.
Exactly.
Okay, did I forget anything?
I think that's it.
Okay, I think we're
got it
good.
covered.
Two heads are better than one. Okay, thank you very much. Hope this helps. Knowledge is power. Okay, goodbye.